Hi, hello everyone. Welcome to Forensic Friday series. So, in this session, I'm talking about drunkenness certificate. Drunkenness certificate. Yeah. As you know, drunkenness certificate is an important exercise in your FMT practicals. In this session, I'm talking about how to write drunkenness certificate, the practical aspects. What are the parts of the drunkenness certificate? Second, how to write correct drunkenness certificate, how to give proper opinion, and what are the common viva questions, what is the format for sending alcohol, that is alcohol estimation, that is blood and urine. All these are very commonly asked. As per CBME curriculum, drunkenness certificate that carry 10 marks in your practical exam. The marks divided like this: general particulars half mark, alleged history around 1 mark, consent 1 mark, marks of identification, general examination, examination of muscle coordination, injuries, systemic examination, collection of materials for the analysis, and the opinion. The very important component, that is your opinion. The second important component, that is examination of muscle coordination. Muscle coordination. What are the tests for the muscle coordination? Like Romberg test, walk on straight line test. All these are commonly done. So this is how it is distributed. The marks are distributed related to drunkenness. Let me discuss briefly. So this is the format we use in writing drunkenness certificate. That includes like this: MLC number. You need to write MLC number. What is MLC? Medico-legal case. Like example, road traffic accident is a medico-legal case. Case of assault, medico-legal case. Sexual assault, medico-legal case. So MLC number you need to mention if it is given in the exercise. Then OPD number, IPD number, name, age, sex, address of the person, brought by police officer and the police station, and the consent. So you can take written consent in case of examination of drunken person. But if the person is arrested, then under 53 CRPC, the consent is not needed. You can examine even without consent from the patient. Even with reasonable force, you can take the requisition from the police officer that time. So that can be asked in your exam. Whether the person is under arrest, yes or no, that you can mention. Also, you need to mention date, time of arrest, date and time of examination, and identification marks. At least 2 identification marks you need to note down while examining the patient. Like example, mole, example, scar mark. So that is for identification of the person Next, the next component of the drunkenness certificate. So as I discussed before, drunkenness certificate, in the beginning you need to write all the preliminary details. Then you need to take the consent, and also you need to write the alleged history of the incident. Next, brief history. So brief history can write related to alcohol intake. If patient is conscious, you can take the history from the patient. If patient is unconscious, what to do? Then you can take the history from accompanying person. In that case, specify name and the relation. History related to alcohol. Type of beverage. What is the type of beverage taken? What are the types of beverages you know? So it can be beer, it can be vodka, it can be rum, any beverage. So each beverage contains different levels of alcohol. Like example, in whiskey, vodka, it's around 45 to 50. Beer, it is around 6 to 10%. Then quantity and time of consumption. What is the quantity? Whether it is 30 ml, 60 ml, or it is 90 ml of the alcohol, small, large, extra large, if it is given. Whether it is consumed with the food, whether there is a gargling of mouthwash, gargling with the mouthwash is, in that case, there won't be any smell of the alcohol from the breath or from the mouth. Then also, you should ask the history about the medical illness. There are some conditions, medical condition, they resemble like drunkenness. One classical example is head injury, like extradural hemorrhage. The signs and symptoms resemble like drunkenness. Head injury or diabetic coma, hypoglycemia, or some drugs. So we need to rule out the medical conditions simulating drunkenness. Drunkenness. What are they? Head injury, hypoglycemia, diabetic pre-coma, epilepsy, Parkinson disease, cocaine and morphine, febrile illness, fever, and carbon monoxide poisoning. So all these are the conditions that can resemble like drunkenness. So the question can be asked, what are the medical conditions simulating drunkenness? The answer should be like this. Then comes is the general examination. General examination, you need to mention build, nourishment, height, weight, pulse, temperature, and the orientation. Whether the person is oriented or disoriented to time, place, and person. Whether there is a smell of alcohol from the mouth, smell of alcohol from the breath. Okay. Then state of clothing. What is the status of the clothing? Whether they are disturbed or they are normal. Also, you should look the speech and eye examination. In speech, whether speech is normal speech, thick slurred speech, cutting speech, confused. No, alcohol is a CNS depressant, is an inebriant. In mild doses of alcohol, so it inhibits higher center or inhibitory center. When there is inhibition of inhibitory center, there can be apparent stimulation. So apparent stimulation of the brain, in that case, there can be aggressive behavior, or the person can be over precise than the normal. Okay. Then about the eyes. Eye examination is very important. In eye examination, you should look for whether there is a presence of conjunctival chemosis or not, whether pupil is dilated or normal, You should look for any visual acuity defects. Also, you should look for nystagmus. There can be horizontal or vertical nystagmus when blood alcohol level is more than 80 milligram per cent. And also, you should look for response to light, response to reactive, non-reactive. So, all these are the important points you need to mention under general examination. That is point number 12. Now, point number before that, look at this. So, in case of alcoholism, there can be nystagmus. This is what the nystagmus present here. And also, look at the size of the pupil. The pupil is dilated. Remember, under influence of alcohol, the pupil is dilated. In case of alcoholic coma, the pupil is constricted. So this can be asked in your exam. Also, you should look for any visual acuity defects and reaction to light. Eye examination, one very important component of the Drunkenness certificate. Next is the very important neuromuscular examination. What you can say, this examination is essence of drunkenness certificate. You must examine the neuromuscular condition. Say example, you should examine for muscle coordination. If he is under the influence of alcohol, there will be muscle incoordination. How to detect that? By finger nose test. Finger nose test. Or finger test. Finger test, you know. Or picking a pencil from the floor. Or you can watch his gait, walking on straight line. If they are all affected, then must be under influence. If everything normal, finger nose test is normal, finger test is normal, then he is not under the influence of alcohol. He has consumed alcohol, that's all. So next comes is the reaction time. Romberg test. So in Romberg test is positive in cerebellar disease. It is also positive under alcohol intoxication. There will be swaying person on closure of his eyes. So that is known as Romberg test. This is a very important component. This you need to consider. Okay. The next comes is the injuries. Any injuries. There can be history of road traffic accident. There can be multiple injuries on the body. Or a case of assault, there can be injuries. If any injuries, you need to mention. Then systemic examination. Write about CVS, CNS, RS for abdomen. So CVS, look for any hypertension. Also in CNS, depressed reflexes. Respiratory system examination, there can be shallow breathing, deep breathing, slow breathing, hurried breathing. For abdomen, there can be liver cirrhosis, hepatomegaly. It shows that he is suffering from chronic alcoholism. Here the question can be asked, what are the types of alcoholism? So alpha, beta, gamma, delta and epsilon alcoholism. So this can be asked in your exam. Types of alcoholism. So this is how we do eye examination. We usually look for nystagmus, right? Horizontal nystagmus or vertical nystagmus. So here there is no nystagmus, looks normal. Next, also walk and turn test, whether it is normal, abnormal. walk and turn test. If he is under the influence, it will be abnormal, right? Also, you should look for reaction time, whether it is normal. This is walk and turn test. Then finger nose test. Finger nose test. This is finger nose test. It is also positive in case of cerebellar disease. Romberg test is also positive in case of cerebellar disease. So, unclosure of the eye can be swaying or loss of balance, eyes open or eyes closed. Romberg test. This can be asked in your exam. Demonstrate Romberg test. Need to demonstrate. Okay. Here it is normal, or you can say Romberg test is negative. One leg stand test also that shows that the person is under the influence of alcohol. One leg stand test. So all these are the tests for muscle coordination. Okay. One leg stand test. Then comes the point number 16, collection of materials for analysis. What are the material? One is the blood, second one is the urine. Finally, the opinion, the provisional opinion. Provisional opinion. The opinion can be of three. So option A, B, and C. Opinion number 1, there is nothing to suggest that the person has consumed alcohol. Can be the person has consumed alcohol but not under influence. Person has consumed alcohol, is under the influence. Any one of these is the opinion. Okay. Finally, place, date, nature of doctor, name, designation. So Dr. Manjunath, so designation, professor, college, Molanajan Medical College, and registration. That you can write it down. And how to give report, how to interpret, that is important here. Interpretation like this. When there is no smell, okay, no smell in breath, or when there is chemical analysis which is negative and all clinical findings are normal, then the opinion is person has not consumed alcohol. If there is a smell of alcohol from the breath, smell of alcohol from the mouth, when there is a congested conjunctiva or conjunctival chemosis, dilated pupil, chemical analysis shows presence of alcohol, but clinical examination show no positive findings. Muscle coordination is not. Then you can give the report has consumed alcohol, but he is not under the influence. Okay, he has consumed it. You can see the beer here. Okay, has consumed but not under the influence. When there is a smell of alcohol from the breath and the mouth, when there is a congested conjunctiva, dilated pupil, chemical analysis shows alcohol along with positive clinical findings, then when you report person has consumed alcohol but is also under the influence. So this is how you should give report in case of drunkenness certificate. Yes. Now comes is the what is the format? What is the format for sending blood and urine for alcohol estimation? The format is like this. So the hospital, that is hospital name you can mention. To whom you should send? To FSL laboratory, Deputy Director FSL laboratory for the alcohol estimation, for qualitative and quantitative alcohol estimation. You can write name, MLC number, train number, police station and all you can mention. Like Daryaganj police station, Delhi, MLC number, name of the patient. Samples collected, blood. A question can be asked. What is the preservative for blood? Your answer should be sodium fluoride and potassium oxalate. Sodium fluoride inhibits anomalase enzyme. Potassium oxalate, which is an anticoagulant. The amount of blood needed is 10 ml. And the urine. The urine, 2 samples needed. One at the beginning of the examination. One more sample after 30 minutes after starting the exam. So usually 10 ml of urine. The preservative is thymol. Thymol per 1 ml of concentrated hydrochloric acid. So then you can write the signature. So this is how we are sending sample in case of drunkenness certificate. Next comes is the viva voce question. So what are the common viva voce questions that can be asked in your exam? The first question can be like this. Define drunkenness. What is drunkenness? That is the basic question can be asked. You need to define it properly. Or the question can be asked, what are the different preparations of alcohol and the concentration of alcohol? So drunkenness, according to standard textbook, need to define like this. It's a condition produced in a person who has taken alcohol. What is alcohol? Ethyl alcohol. In a sufficient quantity. What do you mean by sufficient quantity? The question can be asked, what is the legal limit of alcohol? 30 milligram percentage. To cause him lose control of his mental physical faculty to such an extent that he is unable to execute safely the occupation in which he is engaged at particular time. Like example, driver of a car or a two-wheeler, when he is under the influence of alcohol, he is unable to do the activity, he is engaged at the time. It can lead to road traffic accident. Or it can be an example for infamous conduct. While doctor is under the influence of alcohol while treating the patient. So all this comes under definition. Next, second question. Is it necessary to take consent from a drunken person arrested by police? Consent is needed or not? Your answer should be no. Consent is not needed. Going to section 53 CRPC. 53 CRPC is not needed. How do you give opinion? Already we discussed that. What is the differential diagnosis of drunkenness? Already we discussed that. Head injury and all. Head injury, hypoglycemia, uremia, vertigo, epilepsy, drugs like morphine, antihistamine, insulin, carbon monoxide poison, all they resemble like drunkenness. Here, head injury means EDH, extradural hemorrhage, as a result of bleeding from middle meningeal artery. This can be asked. What is the statutory limit of alcohol or blood alcohol concentration in India? It varies from one country to other country. In India, it is 30 milligram percentage. According to Motor Vehicle Act 2019, Motor Vehicle Amendment Act 2019, it is 30 milligram percentage. What is the punishment? So it is recently amended. The punishment is for the first offense. For drink and drive, 6 months of imprisonment, 10,000 rupees fine. For the second offense, repeat offense, 15,000 and imprisonment for about 2 years. This can be asked in your exam. Then one more difficult question can be asked. What is section 202, 203, 204 of Motor Vehicle Act 1988? What is that? This can be asked. See, 202, it is power to arrest without warrant. No, to arrest any person, warrant is needed in non-cognizable offense. But here, in case of drink and drive, a police officer in uniform may arrest without warrant if the person commits an offense punishable under 184, 185 and 187. What is 203? Related to breath test. It deals with the breath test. Breath analyzer is conducted by the police officers on a suspected drunken person. If suspected person refuses to undergo breath test, no, I am not interested to undergo breath test, then police officer may arrest him without warrant. This is 203. What is 204? 204 states that sometime what happens to confirm drunkenness, laboratory test is needed. When person is arrested under 203 of Motor Vehicle Act, when he is examined by registered medical practitioner, doctor can examine him without consent under the section 53 CRPC of criminal procedure, also by applying reasonable force if it is needed. So, in simple word, you can remember 202 power to arrest without warrant, 203 that is related to the breath test, 204 laboratory test, laboratory examination even without consent of the patient under the section 53 CRPC. Then the question can be asked, what are the various stages of clinical features of acute alcohol intoxication? There are three stages: stage of excitement, stage of incoordination, stage of narcosis or coma. Again, blood level 50 to 150, there can be excitement, euphoria. Incoordination, like Romberg test is positive or other test positive when there is a 150 to 300 milligram. Stage of narcosis, when blood alcohol level is more than 300 milligrams. And remember, in case of alcoholic coma, there is one important sign that is known as 𝐒𝐿 sign. Can be asked in your exam. What is 𝐒𝐿 sign? 𝐒𝐿 sign is positive in case of alcoholic coma. Normally in alcoholic coma, pupil is constricted. On slapping or stimulation, like pinching the skin, okay, like this, pinching the skin or slapping, there can be dilation. So when it is dilated, when it is returning to the normal size slowly, then it is positive 𝐒𝐿 sign, which is present in alcoholic coma, which is absent in other conditions of coma. This can be asked in your exam. Next comes is what are the tests actually? We discussed already. A test for muscle incoordination. Gait, you can look for the gait. Gait is abnormal. Romberg test, also positive in cerebellar disease. Finger to nose test. Buttoning, unbuttoning shirt. Buttoning, unbuttoning shirt. In under the influence of alcohol, this buttoning, unbuttoning can be not possible. Not possible, not proper. Walk and turn test. Handwriting also, you can check handwriting also is affected under the influence of alcohol. Stand on one leg test also affected in case of under the influence. So all these tests to rule out whether under the influence or not. The influence or not. Okay. Then what is 𝐒𝐿 sign? We already discussed it. That is before stimulation, constricted pupil. After stimulation, dilated pupil. Very interesting picture here. Interesting picture. So this McEwen sign is positive in alcoholic coma when blood alcohol level is more than 300 milligram percentage. Here the question can be asked, what is the treatment of methyl alcohol poison? Okay, methyl alcohol poison. The question can be asked. What is the fatal dosage? What is the fatal period? What are the postmortem findings? Or the question can be asked about ethylene glycol, treatment of ethylene glycol poisoning. Okay, all this can be asked related questions in your exam. And the last question, what is the Widmark formula? One more favorite question of the Widmark formula is a formula for alcohol estimation. Remember, A is equal to PCR. A is equal to PCR. The Widmark formula. A for amount of alcohol present in the body. P for, that is the body weight. T for blood alcohol concentration. R for constant it is. Males constant is 0.6, females it is 0.5. Again the question can be asked, why the constant in male it is 0.6, why is it female it is 0.5? The answer should be, females they have less water compartment, have more fatty compartment. As you know, ethyl alcohol is a water soluble poison, so even small dosage in females can give high effect in comparison with effect in male. So this is how you should answer. So what is Widmark formula? A is equal to PC. Finally, I have a question for you as we discuss in our classes. Gabbar Singh. A Gabbar Singh, 50-year-old, arrested by police officer for misbehavior at public place. On examination, there is a smell of alcohol, muscle incoordination present, Cronbach test is positive, blood alcohol level is 50 milligram percent. And this is how he looks. You can see the image video there. There is a muscle incoordination and he is under the influence, right? So now your answer must, what is your answer? Option A, person has not consumed alcohol. Option B, person has consumed alcohol but not under influence. Option C, consumed alcohol under influence. Option D, auto brewery. So write your answer at the comment section and also write the answer. What do you mean by auto brewery syndrome? Auto brewery syndrome. So this completes this week class, that is drunkenness certificate. We'll come up with some more important exercises in coming classes on Friday. Thank you.